Today what we're going to do is demonstrate how to do a strep culture on a patient. First of all, I want to let you know that there are various types of strep kits that are out there. This one is a cassette. This one is a dipstick. They are very similar in nature. Each kit comes with the following. Package insert, the directions on how to use. This is the cassette, so it comes in a package. Also noting that it's a Strep A cassette. It is also tells you the lot number and the expiration date. Comes with a holder. Each kit comes with swabs, throat swabs. The reagents, extract 1, as well as 2. And then with each kit, you also get a positive control and a negative control. Anytime you open a new box or new kit, you will need to do both the positive and the negative control. See the directions on how to do that. Also comes with a vial. When opening a new box, always make sure that you put the open date on the box, somewhere on the box. Okay. Now what I would like to do is also show you that anytime that you do a strep kit or a strep test, you will also need to log that strep into your log book that is should be located in your lab. And that is here. Noting also, when you do your positive and negative control, you would also note that information in this area, both positive and negative, noting the date, the time, and who did the test. Okay. Now I'd like to go ahead and demonstrate on how to do a strep culture on a patient. Gathering my supplies, which would be a tongue depressor and 2 throat swabs. Some of your labs will supply you with a dual throat swab package altogether. For our testing purposes, we're using 2 single swabs. I'm going to go ahead and set up for when I bring the specimen back to the lab so it's ready to go. This is your cassette. Noting that this is your well. The T line is for your test line, and the C line, or the C, stands for your control line. On your directions, it will clearly tell you whether it is positive or negative. If there are 2 lines, that means it is positive. Even being a faint line at the test line still means it is positive. If there is 1 line, that means that is your control line. the test has ran correctly. If you have just a line at the T, meaning test, and not a line at the control line, that is an invalid test, and do it again. I'm going to initial, put my patient's initials here on my patient's test, just in case there are other staff running a test at the same time. Now I'll proceed to my patient's room. Hi, Gloria.
Hello.
How are you?
Pretty good.
Good. I'm Peg. I'm working with the provider today. Can you tell me your name and your date of birth, please?
Gloria Moira, July 1st, 1987.
Okay, excellent. The provider came out and asked me to do a strep culture on you.
Okay.
Have you ever had that done before?
No.
Okay. What that entails is I'm going to take a tongue depressor, depress your tongue, ask you to say ah,
Okay.
and hold the ah as long as you possibly can.
Okay.
In the meanwhile, what I'm going to do is I'm going to take 2 swabs and I'm going to go towards the tonsillar area, okay,
Okay.
and swab on each side,
Okay.
right? You may feel like maybe a little bit of gag reflex, okay, but that is common.
Okay.
And I'll do it as fast as I possibly can.
Okay.
Okay, do you have any questions for me?
No, not now.
Okay. And then I'm going to take it to the lab, run the test real quick. It takes 5 to 7 minutes to do.
Okay.
All right. So how long you been having your sore throat?
3 days.
Okay. Anybody else in the house ill?
Not that I know of.
Okay. Taking the swabs out, making sure that you do not contaminate the swabs. And also the tongue depressor, only touching one side of the tongue depressor. Okay, here we go. What I'm going to ask you to do is, again, open up real wide as you possibly can,
Okay.
and say ah. If
Okay.
you have to scream at me, go ahead. Okay,
Okay.
that'll open your mouth up a little bit more
Okay.
for me.
Okay.
Okay?
All right.
All right, so 1, 2, 3, here we go. Say ah on this side and then this side. Okay, excellent. All right, any problems?
I feel like gagging. But
Feel like gagging? Okay, that's normal.
Okay.
Okay, so I'm going to take this, I'm going to run the test real quick,
Okay.
and then I'll be back with your results.
All right. Thank you.
All right? After acquiring the patient's specimen, what you will do is to come back into the lab and actually run the test. Placing one swab in the test tube. The other swab, you will streak the auger plate. Going back and forth, making sure that you do not gouge the plate. Put the lid on. And label your specimen with the date, the time, the patient's name, as well as date of birth, and where the specimen came from. So you would label it throat. From there, we would run the quick strep. It's in your lab. According to the directions, you're going to go ahead and add 4 drops of reagent 1. 4 drops of reagent 2. Place the swab in the test tube, rotating it 10 times, and setting your timer for 1 minute. Your 1 minute is up. You'll take the swab and squeeze it out. Placing the cap on. Then placing 3 drops into the well. Set your timer for 5 minutes. Document in your logbook. Noting the internal control, patient's name, date, time, and the results. Note how your solution comes across your cassette. Okay. When you simulate your 5 minutes, let's say our 5 minutes is up, and we're going to read the test. Again, in your offices, you will not read the test until the time that is allotted is up and your timer goes off. Timer has gone off. Now we're going to go ahead and read our test. There is one line, the test is negative. I'll report that to my patient at this time. Well, Gloria, your test came back and it was negative.
Okay.
Okay, so what we're going to do is we're going to go ahead and take a culture that we've already obtained from you and we'll send it to the lab. And it will take 48 to 72 hours for that test result to come back to us. In the meanwhile, what I would recommend is follow the directions that the physician gave you, the usual rest, sleep, push fluids. Okay. In the meanwhile, just in case it does come back positive, can you tell me which pharmacy that you would like medications called into?
Yes, the Hy-Vee on Johnson Avenue.
Okay. And you're not allergic to any medications, I see?
No.
Okay. All right. So you will hear back from me in 48 to 72 hours. Okay. So I will let you go ahead and you can go ahead and check out the front desk and go from there.
All right. Thank you.
All right. Thanks. Have a great day.
You too.